join us now? Yes. So we started speaking about to follow to the doctors to remember the questions, and here are the questions about sight. We were right. Where exactly is the pain? One of the versions. Onset. When did it start? Was it constant, intermittent, gradual, sudden? It's also important to know how sudden the pain was, or it came gradually. About the character, what is the pain like? For example, sharp, burning, tight, radiation. Does it radiate? Does it move anywhere? Associations. Is there anything else associated with pain? For example, sweating, vomiting. About timing, does it follow any time pattern? How long did it last? Then exacerbating and elevating factors. Does anything make it better or worse? And severity. How severe is the pain? Consider using the 1 to 10 scale. So just these are the questions. Actually, so there are the questions in the book. I think no. Anyway, it's not hard to remember them, and I mean that we'll be just working with these questions today, so you should try to remember them. And now, if we move to the next slide, here is the beginning of the listening task. We can see here the picture representing Dr. Martin and Mr. Wood, his patient. And what is Dr. Martin doing here in the picture? Doctor, what is he doing?
You check his breath, maybe?
Yes, so he's listening to
The heartbeat and for the breath.
or the heart, yes. And what is this device or instrument? What is it called?
Stethoscope.
Stethoscope. Okay, yes. Now, yes, before we start listening to the conversation, I would like you to focus on some abbreviations that are shown here on this slide. And let us decide what the abbreviations stand for. Abdul Rahman Ahmad Talak Bani Khaled. Well, so the first line here, Abdullah.
Yes, sir.
So what does it mean?
Plus 104 minutes.
What is it?
I think the circulation.
So 100 what? 100 beats per minute, right? So
yes,
this, okay. Well, the second line, the abbreviations, Abdel Rahman. Abdel Rahman, hello.
Yes.
Yes, line number 2, BP. What does it mean? Can you guess the meaning of these letters, this abbreviation? No, who can help? Who can help us? Any ideas?
It's the blood pressure.
Blood pressure.
Blood pressure. This is blood pressure 100 to 70 millimeters of mercury. Yes, because mercury is used in this device. Well, then let us listen to Ibrahim. The next line.
Yeah, GVP is not elevated.
JVP. So
GBV, venous hypertension.
yes, this is pressure. You are right. Jugular venous pressure. Yes, it's not alleviated, so it stands for this information. Then I will look at the next. This is for Bakhtavar, please. Number 4.
Doctor, it is the chronic villus simply, CVS.
Actually, yes, it's hard to guess. Anyway, we have in number 4, in number 9, we have one and the same word, NAD. So it means that it stands for some kind of condition. And Roa knows about this condition. Okay, NAD stands for
NAD, doctor?
Roa?
NAD?
Here, NAD, like 4 and number 9.
I think it is abnormality detected.
No
No
abnormality detected. And CVS, this is system, you are right, but this is what kind? Yes,
Radiovascular system.
cardiovascular system. Yes, okay.
Yeah.
So, right. And so what about the next rolla? Number 5.
O over E is means on examination.
On examination, exactly. Then there is widespread early inspiratory fine crepitations. Crepitations. Do we know the meaning of this word? So, crepitations. Inspiratory means connected to lungs, right? For example. Or okay.
Is it like cracking voices?
Some sounds, right?
Yeah.
Audible. What is it? Audible.
It's capable of being heard.
Exactly, yes. Then abdomen normal, and the last line. So Yara, what kind of
CNS?
system? Yes, CNS.
CNS.
So number 4 was cardiovascular system, and number 9, which system?
The central nervous system.
Exactly, central nervous system. So there are a lot of abbreviations and initials and acronyms. Just doctors use in their practice. So yes, here they are. So we were right. And as for crepitations, here there is the definition. Crepitation means a peculiar cracking, crinky, or grating sound around the lungs. This is crepitation. Okay. Actually, if we move to the next slide. Can we move to the next slide? Yes. Here it is. And well.
Doctor, we can't see next slide.
You can't see my next slide.
Yes.
Let's try to re-enter. Like, can you see it now?
No, we can see. Yes.
It's listening. So this is Dr. Martin and Mr. Wood conversation, part of the conversation between them. Dr. Martin is working as a doctor in A&D, Accident and Emergency Department. As you listen, make your own notes about Mr. Wood's presenting complaint. So what he says about his condition. So it means that you need to just write something on paper. So please, we are going to start listening, and then we'll discuss what we do understand. And you should say, you should tell me if you can hear the recording.
Listening 3.
Can you hear?
Yes.
Okay, good. Now let's start.
Listening 3. Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
OK, we'll get some for you. And I'll be as brief as I can.
Thank you, Doctor.
Can you show me exactly where the pain is?
I've been getting it right here, in the centre of my chest.
Right, I see. And how long have you had it?
For the past hour.
The past hour. And is the pain constant?
Yes. At the moment, it's there all the time.
And does it go anywhere else?
At the moment, it's just here in the centre of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's okay. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden, and the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
OK. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
OK. And have you felt sick at all?
Yes.
And have you been sick at all?
No. I haven't brought anything up.
OK. I'd like to ask you some questions.
Well, we've listened to the beginning of the conversation. So what have you learned from the conversation? Yes.
What he said, Mr. Wood. So he have a chest pain and trouble with his breath, and the pain it's in the center of chest, and it's like for the last hour, and it's also constant, and it's in the left chest, and the pain like the short pain. And the first pain, it's like for 2 weeks ago, and he working as a bus driver, and in the chest it's new. It's just for 2 weeks, but in the shoulder it's like for a month. That's what I.
Okay. Just can anyone add something? Okay, just you understand just everything, and sometimes we have some just problems with understanding. Sometimes we miss some information. It's rather hard to get all the information. And how should we improve our listening skill? We can do like this. For example, we've listened for the first time and we see that we've missed something. Then, if it is possible,
Listening 3.
Just we can find the script of the listening. And here is the script. And let us just let us listen for the second time. Now looking at the script, reading the text, I mean, and comparing with what we do understand from the previous listening, and just clearing all the details that we've missed during the first listening, and just compare how good we are at listening. Now let us listen for the second time, and maybe we can get some more information. Now.
Listening 3.
Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
OK, we'll get some for you. And I'll be as brief as I can.
Thank you, Doctor.
Can you show me exactly where the pain is?
I've been getting it right here, in the centre of my chest.
Right, I see. And how long have you had it?
For the past hour.
The past hour. And is the pain constant?
Yes. At the moment, it's there all the time.
And does it go anywhere else?
At the moment, it's just here in the centre of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's OK. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden, and the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
OK. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
OK. And have you felt sick at all?
Yes.
And have you been sick at all?
No. I haven't brought anything up.
OK. I'd like to ask you some questions.
Well, what are the details that maybe we've missed in the first, while listening for the first time?
The pain was constant,
Mhm.
and also he felt tightness, and he thought he had arthritis for like a week on and off.
Mhm.
And he had dull pain and shortness of breath when he bent over like 2 weeks ago.
In the garden. Mhm.
Yes.
And he feels sick?
Mhm. He felt sick.
Yes.
Okay. Okay, good. And so just if we
Listening
move here to this slide, so the first question we already said, what does Mr. Wood do? One more
He's a
time.
bus driver.
Bus driver, yes. So he gets up early in the morning on a frosty morning, he says, and it's not the best job for his condition. And the question is, does Mr. Martin follow Socrates' model? Does he?
Yes.
Yes. So he asks the questions about location, character of pain, for onset,
And the time?
time, exactly, yes. So just he's aware of this model. And so Mr. Wood was speaking about the shoulder pain, the pain in his left shoulder. And so what is the correct diagnosis for the shoulder pain? He also mentioned this name of this disease.
Arthritis.
Arthritis, yes, just a touch of arthritis, as he says. And what did he do with this just when he felt pain in his left shoulder?
He rubbed some liniment on
Yes.
it.
Yeah, he rubbed some liniment, okay. And so now if we think about the diagnosis for his condition. Now, what is the immediate treatment for this disease? I mean, it's not arthritis, but Mr. Wood described some symptoms and what
Killer
is
disease. We give him the killer disease.
yes. So and the diagnosis is what? I mean the pain in the chest and so the short of breathness. What is the disease? Is it connected with heart?
Yes, the chest is connected to the lung, and
And
it could be connected to the lungs as well.
okay. So, and for example, if you speak about heart problems, what is your diagnosis, doctors? No idea. So, yes, Dr. Abdallah.
Doctor, I think it's rheumatic inflammation.
Will you repeat?
His lungs.
Lungs.
I think it's rheumatic inflammation in his lungs
I see. Mhm.
because he work in a garden and because he work in bus. That's right.
I see. Okay, sure. So actually, this is like angina pectoris, right? So the problem with his heart. And so the treatment, for example, for the heart disease is just painkillers, some administration of aspirin as the first aid, immediate treatment. Okay, now, so we were listening to the conversation, and now let us focus on some grammar issues related to the communication between doctor and patient. So understanding, so this is, we are going to speak about tenses in presenting complaint. Understanding the time patients are referring to when they speak is crucial to making a correct diagnosis. And so when they describe their conditions, they normally use the present tenses, grammar tenses. So you remember that there are 4 present tenses in English for the verbs, the present simple tense, present continuous, present perfect tense, present perfect continuous. So just let us refresh what we do remember about these forms of verbs. What does the verb in the present simple express? Yes, Roa.
Can I talk about what is the difference between present simple?
Yes.
Yeah.
Yes.
Okay. The present simple uses of present simple is, I think, to a general, how to say,
general truth.
When something is general or always true, and to habits and routines, and I think a condition, and something is happen regularly, based around now, and the forms of a present simple is the subject and verb one. In singles subject, we add the s or es to verbs, and in plural subject, the verb is base, and uses of present continuous when an action happened at this moment. Okay.
Exactly.
and in present continuous, we use the helping verb is am/are, and the verb always at the end of ing.
Exactly.
And in the present perfect, we use it to talk about action that starts in the past and is continue now. And the forms of present perfect, the subject and have or has, and verb 3.
In the third form.
Yeah, uses for present perfect continuous. The present perfect continuous similar of present perfect. It uses it to talk about action that start in the past and continuing now. But the difference is the forms. In present perfect continuous, subject plus have, has and or have plus pen and the verb ing.
Well, you're an expert in grammar. Thank you so much, Roa. I meant, yes, well done. I meant that just to tell you about all these tenses, but just your answer was very good. And I mean that there are some maybe examples to illustrate what Roa has said. So about the present simple. So as you see, something that is true at the moment of speaking, like I feel better. This is just the example. Then something that is happening on a regular basis around now. I get these headaches in the morning regularly every morning. Then a condition. When I lean forward, the pain goes away. The pain starts in my chest and moves up to my shoulder. So this is how patients can describe their condition. And as Ro told us, so we add S or ES at the end of their verbs when we speak about third person singular, like he, she, it. The pain can be replaced by it goes, it starts, it moves up, and so on. And as for the present continuous, yes, function. One of the functions is something that is happening at the moment of speaking, and the examples are here. His blood pressure is rising. Is rising. This is the form. I'm having difficulty breathing. Am having. Then something that is happening around now, but not necessarily at the moment of speaking. Are you taking any medication? It means not now at the moment of speaking, but this week, for example. Or I'm having chest pains just for the last 3 days. And one more function, something that has been arranged for a date in the near future. Some arrangement with the doctor, for example. And like here in the example, I'm seeing a psychotherapist next Wednesday. It means this will happen for 100% next Wednesday because I have the arrangement. So, and to express this, we can also use the present continuous, not future forms. And one more important thing to remember when we speak about the present continuous, that some verbs are not used in continuous forms. For example, the use of have in the present continuous to refer to the moment of speaking is more limited than the use of the present simple. It is generally restricted to expressions such as have difficulty doing something, have something to eat, have a shower. In this meaning, the verbs can be, the verb have can be used in continuous form. For example, he's having difficulty speaking, he is having difficulty speaking English, or just we can use it in the form of the continuous. But if we speak about the meaning of possession, so I can't say I'm having a book. So it's grammatically wrong. I should say I have a book to read, right? So verbs with which describe actions, for example, cook, make, can be used in the present simple or present continuous. For example, I'm making the lunch, am making. I usually make the lunch at the weekend. This is, the first is continuous, the second is simple form. But the verbs which describe states of feelings, not actions, for example, love, need, be, are non-action verbs. They are not usually used in the present continuous, even if we mean now. Instead of continuous, we should use them in the simple form. So common non-action verbs are agree, be, believe, belong, depend, forget, hate, hear, know, like, love, matter, mean, need, prefer, realize, recognize, remember, seem, suppose. So they are called state verbs, right? Non-action verbs. So, and it's not about only the present continuous, it's also about the past continuous and future continuous form. So they are normally not used in these forms. We should use them in simple forms. So, yes, we need to pause.